Appendicitis is a medical emergency that happens when your appendix becomes sore, swollen, and diseased. The appendix is a thin tube that is joined to the large intestine and it sits in the lower part of your abdomen. The appendix also works as part of your immune system and also helps the body to fight diseases. So the appendix can get infected and inflamed, and if not treated, it can burst or rupture. So this is serious and can lead to more infection and death. So what causes appendicitis? Appendicitis always happens when the inside of the appendix gets blocked by something. So this makes it well up and that makes the blockage worse. The bacteria that live inside your intestines are the ones that start up the infection. If you have appendicitis, there is a serious risk that your appendix may burst. So this can happen as soon as 48 to 72 hours after you start having symptoms. So because of this, appendicitis is a medical emergency. So if you have any symptoms, you should see your health care provider right away. So when the appendix becomes sore and swollen, the blood supply to the appendix stops as the swelling and soreness get worse. You should remember that all the organs in your body need the right amount of blood to stay healthy. So without enough blood flow, the appendix starts to die and it bursts because its walls start getting holes. So these holes let stool, mucus, bacteria and other things leak through and get inside your belly. So this leads to peritonitis. Peritonitis is a serious infection throughout the belly that happens when the appendix or any other part of the intestine or stomach has a hole and leaks out its contents. So who is at a risk of appendicitis? Appendicitis is the most common cause of sudden belly pain that requires surgery. So it mostly happens in teens and young adults in their 20s, but it can happen at any age. Also, having a family history of appendicitis may raise your risk, especially if you are a male. What are the symptoms of appendicitis? Symptoms of appendicitis vary, but today we are going to talk about the most common symptoms. Number one, pain in the abdomen. So this is the most common symptom. So this pain may start around your belly button area and move to the lower right hand side of your belly. Or it may start in the right hand side of your belly. So this pain might also get worse as time goes on. So you may feel worse when moving, taking deep breaths, being touched, and also after coughing or sneezing. So this pain may also be felt over your belly when your appendix bursts. Other symptoms may include number one, stomach upset and vomiting. So this comes after digestive irritation, blocked intestines, and toxin release. Number two, loss of appetite. So this comes due to inflammation of the appendix, which triggers pain and a slowed digestive system. Number three, fevers and chills. So fevers and chills in the appendix occur due to the body's immune system to infection and inflammation. Number four, constipation. So this occurs due to inflammation and reduced intestinal movements. Number five, diarrhea. So this happens due to intestinal irritation and pelvic appendix inflammation. Number six, trouble passing gas and swollen belly. So you should remember that symptoms of appendicitis may look like those of other health problems. So you should always see your healthcare provider to be sure. So how is appendicitis diagnosed? So in most cases, your healthcare provider will start by asking about your past health and then do a physical exam. They may also order for blood tests to check for signs of infection, such as having a high white blood cell count, urine tests to see whether you're having a urinary tract infection. You may also have some imaging tests. So these tests include abdominal ultrasound, the sonogram. So this shows the internal organs as they work and also checks how blood is flowing through different blood vessels. Number two, CT scan. So this is a computerized X-ray that shows detailed images of any part of the body, such as bones, muscles, fat, and organs. Number three, MRI. So this scan uses a large magnet and radio waves to show different details than a CT scan. So it is sometimes used to diagnose appendicitis, especially in pregnant women, instead of a CT scan. So how is appendicitis treated? Appendicitis is a serious medical emergency and it's more likely the appendix will burst and cause a serious deadly infection. So for this reason, your healthcare provider will most likely to tell you that you need to have a surgery to remove your appendix. So today I'm going to talk about the two ways your appendix might be removed. Number one, traditional or open surgery method. So in this method, you're given anesthesia and then an incision is made in the lower right hand side of your belly. Then the surgeon finds the appendix and takes it out. If the appendix has burst, a small drain may be put into the area to drain out pus and other fluids in the belly. The drain will be taken out in a few days when your surgeon feels the infection has gone away. Number two, laparoscopic method. This method, you're given anesthesia, then several small incisions are made, and a laparoscope, which has a camera, is used to look inside your belly. The surgical tools are then placed through a few small cuts. Then the laparoscope is placed through another cut. A laparoscopy can also be done if the appendix has burst. So if your appendix has not burst, your recovery from appendectomy will take only a few days. But if your appendix has burst, your recovery time will be longer and you will need antibiotic medicine. So you'll be treated for a few weeks with antibiotics and drainage if the infection around the appendix is too severe for immediate surgery. Surgery to remove the appendix is done at a later time. So occasionally, appendicitis can be treated with antibiotics without any surgery. However, these cases are provided by your healthcare provider after evaluation. You should note that you can live a normal life without your appendix. So what are the possible complications of appendicitis? The main problem of appendicitis is the risk of a burst appendix. This may happen if the appendix is not removed quickly. A burst appendix can lead to infection throughout the belly called peritonitis. So peritonitis can be very serious and even cause death if not treated right away. Thank you very much. I'm Moji. Please follow me, like my videos, save, comment and share.